couple of housekeeping events. The first one being financial. After the lovely dinner that we had yesterday evening, some of you may not have received your receipts, and I have them here if you need them. And for a small price, you can get two. So we have them here. Also, we have translation service operating today. So I think all of you picked them up. But in case any of you are looking for a translation service, we have translations between Italian and English. I suppose our exploration today on independent living and housing and demotics is, it's a really important issue, and I think it's one of the key challenges in our route towards trying to create an age-friendly Europe. And we had some very interesting presentations yesterday. I think first of all it was very interesting to hear Mayor Honsel talk a little bit around how they have used the Healthy Cities project here as the pathway into some of the innovation and change. And I suppose how he highlighted, change operating on three dimensions. One on the environment, physical and material changes. One on more of the kind of cultural, organizational and programmatic changes, and then the third being on the technology. And I think they're the three themes that we're going to get a chance to explore today in relation to housing, care models and technology. So we have a lot to go through today. Thank you all for making it. Whilst you're going through and we're listening to the 5 presentations that we've got, the AFE InnovNet had sent out in the briefing papers 4 or 5 issues that you might just want to keep in mind as a basis for reflection in terms of bringing some of the knowledge back from here to your own municipalities. So I suppose one of them was reflecting on how our municipalities and our regions can encourage older citizens to remain longer by looking at greater levels of independence in their homes, and what kinds of policies do we need to make some of our experimental work more mainstreamed and more embedded. Yesterday we had a very in-depth view of domotics and ambient technologies. And I suppose there's a question for us around how can these technologies, once we've got them past the kind of usability tests, how can they be taken on, and are they useful, and how can they fit into our systems of independent care? And then I suppose they're asking also the question of what synergies could be envisaged between the different cases and the different kinds of situations in your own cities and regions. And I think this may be issues around solutions for the younger old and solutions for the older old, and varying levels of independence. So there are a range of things to think about as we go through the presentations today. Because I think really our goal within the project is really to mobilize innovation and change, and to try and accelerate the take-up, so that our innovations really can impact on the qualities of lives of older Europeans. I'm conscious that we have 5 presentations to get through today, and time isn't on our side, and we've been a little bit slow getting started. So it's probably not a great idea putting an Irishman in charge of a clock in Italy, but I shall do my best, because I think we are under pressure to try and finish up by 1 o'clock. So we have about 40 minutes per presentation. I'm going to allow speakers about 25 minutes. And if they're very good, we'll give them 30. But I absolutely want to make sure that we have at least 10 minutes for questions at the end of each session. Without any further ado, I'd like to ask Essi Mäki-Halila and Mari Latinen from Finland and from the city of Tampere to present to us their work on independent living to support people in the city of Tampere. So thank you, if you please.
Okay, thank you, Rod. Good morning, everyone. Thanks for having us here. So my name is Mari Lahtinen and this is Essi Mäki-Hallila and we are from the city of Tampere. And first, Essi is going to tell you a little bit about the city's, the organization structure and some background information. And then she will move on to the services we are providing for the elderly people in our city. And then I will jump in the parts more familiar with me, mainly Tampere Senior Project, and then I will tell you about some services based on technology that we are developing. But Essi, you're welcome.
First of all, I would like to point out that me and Mari work at City of Tampere at the core process of promotion of senior citizens' welfare, meaning that we are basically, our point of view is from the elderly services, not from the social services together. But for a bit background information about our city of Tampere, we have about 223,000 citizens living in Tampere. We are the third biggest city in Finland and the largest inland city in the Nordic countries. And in the elderly services, our strategic priority is to help and care provided in home or home-like settings have reduced the need for institutional care. Here are some numbers from year 2013 of the services where people over 75 years old are. This is a bit old information, but to see in the next slides is that we have much more 24/7 service housing last year and less long-term institutional care. Our city strategy sets the goals of living for years 2014 to 2017. And the goals are that people over 75 years old in own home should live 92%, and in 24/7 service housing should live 6%, and in long-term institutional care maximum of 2%. And these goals are not from the city's strategy themselves, it's also from the governmental strategies, but I will show those targets in the next slides. Here's a picture of our organization that is actually changing all the time. There's going to be some kind of new in the year 2017, but we don't know what it's going to be like. But the main thing is that we are working in this purchase provider model in our city, meaning that even we purchase things from our own sector and from the private sector. And we are working under this Committee for Senior Citizen Services, where we have the deputy mayor, and we make service contracts with the welfare services boards of directions. We've also had this Older People's Council already since 1988, but it became statutory since 2013, when this so-called Act of Senior Citizen Services came up. So that means we were a bit further away or knew already about services like things if you compare to like smaller municipalities in Finland. The Older People's Council must be included in the planning, decision making, and evaluation of older people's issues in all fields. It also has this presenting secretary that it enables its work. We also had this elderly ombudsman in our city since 2011. Right, at this moment we have two. According to law, there has to be social and at least social ombudsman in every municipality, but we in Tampere have also this elderly ombudsman, which is not statutory. It's part of this guidance and monitoring group that we have in our older people's services. Here are some numbers that you can see how much of the budget of the Tampere we are going to senior citizen services. Naturally, the biggest part is the services for promoting health and functional ability, and there's 13% for senior citizen services. Bigger part is than senior citizen services goes to child and youth services. And here you can see a bit more specific allocation of service purchase of our own senior citizens services. The total amount of last year was 192 million euros. And as you can see, the housing services take the largest amount, and the next come the home care services, and institutional residential care and rehabilitation and hospital care both take about 19%. This year, naturally the institutional residential care part is a bit smaller, and the home care and housing services is a bit bigger. But as you can see, there are plenty of these smaller sectors that we also take care of. Here's, as you can see, the numbers that we are all, I guess, sitting here today is that the amount of older people is increasing all the time, especially the people over 75 and 80 is growing. And even though the amount of people over 90 years old, it seems that the green line is going quite stable, but as you can see from in 15 years it's gonna almost double, and as we all know, people over 90 years old, plenty of them are not gonna live in home without some services. So there's something we have to do. As I said before, we also have the national framework for high quality services for older people that sets quantitative targets concerning the structure of services for senior citizens, so not just our own city's strategy. And there in the line Tampere 2014, we can see the latest numbers that our older people over 75 years old are at this time. So we are coming a bit behind with the percent that are living at home with regular home care and with the informal care, but we already reached the percent of people who are in 24-hour basis services. That's mainly because last year we built a lot of new 24-hour houses and housing services. But this year the growth is not going to be that that big, so we are expecting that the people receiving regular home care is going to be bigger, and that people in 24-hour care is going to be, no, at least it's not going to grow. And I think there is the biggest number you can see if you compare year 2008 to year 2014 is that people in long-term institutional care has decreased quite a lot. In 2008 there were 8% receiving that kind of care, but last year there were only 2.6%. And here in this picture you can see that change that is the biggest, especially in the sheltered housing or in the 24-hour care services, that is grown a lot, and that the institutional care has decreased a lot. So that was our goal, and that's what we are doing at the time. But then Mari could tell something about the Tampere Senior project.
Yes, I'm working on this project, so it's called Tampere Senior Aging Society as a Possibility, and it started in 2012 and it's going to last till 2020. So it's a strategic project of the city. And one of the main objectives is to change the way of thinking about old people to positive, involving and appreciating. You know, we're always talking about the burden and how the group of older people are getting bigger and bigger, but we want to change the thinking and give them the respect they earn. And we try to seek new approaches which help the elderly to be active members of the society and also the policy making. And we think that the involvement of the senior citizens with other age groups in our city is the key to success. And the strategic goal and the primary objective in Tampere Senior is to make living at home possible. And we want to make it possible through preventive and rehabilitative services, and by providing round-the-clock services and care at home as required for the people. So as there is going to be an increasing number of people living at home, we need to reconstruct the whole service and care system. And we need to change the attitude of the employees, because now they're going to be going to the people's homes, to the client's home, and the people are not going to come to them to the hospitals or other caretaking places. So it's a big change for the employees also.
Yes, but to get back to the maybe like everyday administrative work that I mainly do in the senior citizen services, it's not only the domotics and electronic digital stuff that support living at home. It's also the services that we are offering before you already when you are in a good shape. For example, we have these service centers. At the time there are 10 of them all around the city. These service centers they are free for all age persons who are living in Tampere. And in service centers you have access to certain facilities, including meals, hygiene, especially sauna bath, because everybody knows sauna is a big thing in Finland. Physiotherapy, food care, barbering, hairdressing. But of course these are all things that a client has to pay him or herself. In service centers there are also various free time and recreational activities. And the main thing is that in service centers that you get socially attached to the people living around you. Then we have this like new kind of service, lähitori service. If you translate lähitori, it means like market near you. At the time we have 2 of them. I'd like to say, I don't know if about my boss thinks about this, but I think Lähitori is more like a service center 2.0 because it gets like there's more client guidance and daily welfare services offering there than in the service centers right now. The main purpose in the Lähitori services is that the client always gets a solution to her or his questions or needs. Like in service centers in Lähitori, they offer daily social contacts, clubs and other activities. Lähitori collects together at one place different operators and service providers of the local area in a local characteristic way. This Lähitori kind of model is something that we've started to pilot for at this time for the elderly, but is something that we are that is going to be people from every age, not just for the elderly in the future. About some financial support that enables older people to live longer in their homes. The government allows these subventions for renovations. For example, bedroom renovation for people over 65. Of course, you have to apply for this. And then our own, this core process where we are working, we offer these reliefs to small alteration work in homes, especially if you are getting out of hospital to home. This is something that the city's own company makes. So it's when you get home, you can get the next day you can get the handle in your bathroom or a slope, so you can get easily to home. There's also this accessibility campaign going on the past few years to get elevators to apartment buildings, because this is a quite big problem. I think in every bigger cities there are so many apartments that don't have elevators, and so then older people get stuck there. To tell you a bit about the home care system in Tampere, home care facilities are available to the age who are living at home and need assistance due to reasons of limited mobility, sickness, or some other reason. The home care facilities cover services and nursing provided at home, including cooking, washing, laundry, ironing, in addition to medical care, of course. And home care also includes as well other support services like meals delivered to home, shopping, cleaning, sauna bath, safety, telephone and transport. These first services are something that are the client fee is based mainly on the hours, how much you are getting the service, and the last ones are more based on one-time client fee, and some of them have this that they are the fees are how much they are related to your income. That's what I was trying to say. In numbers, right now there are about 2,600 clients receiving home care, and personnel there is about 580. Kotitori model, Kotitori, if you translate that, it means home market. It's this home care service integrator that we've had since 2009. It's something that has received also many, it has been quite popular among other foreign countries that we have been developing quite many years now. It's an innovative home care service, integration solution for aging people. Kotitori integrates services provided to elderly people living at home, both public and private. That's the main part of, or the one biggest part of Kotitori, that we encourage the people to also purchase private services. Kotitori is also an information office for elderly people, so there you can find help from how to get cleaning services to how to apply for sheltered housing. In addition to that, Kotitori also produces home care in one district. There are about 300 clients at this time. This service is purchased, and right now we are tendering the service, and a new agreement period starts in the fall. There are quite a lot new things we are doing around it right now. For example, this well-being technology rental shop that we are inventing with the new producer. Here's a picture that shows that Kotitori, as a service integrator, does quite a lot. In one way, it makes these contracts with the other producers mainly in home care, but also in other services like cleaning. So it means that also the private clients can get these services easily from here, but also the city's own home care. If they are, for example, in one weekend lacking personnel, they get the service here quickly. And in other way, the Kotitori has the whole city's client guidance, and we are then purchasing the home care service for one district. But then to Mari again.
Okay, so I'm going to give you a few examples of the technology-based services we are developing. And first is this distance healthcare services that we've been working on for quite a few years now. So as you know, it's in the interest of the elderly people to be able to live independently at home with necessary services and to have the capacity to maintain social contacts. But in the same way, it's also in the interest of the provider of social and health services to save expenses by producing new kinds of services through the utilization of welfare technology. And with these distance healthcare services, we are aiming at providing reliable combined day center and healthcare services to senior citizens to support their home living. And the services are based on interactive communication, means using video and voice. And client specialists are involved in developing the services and testing the different devices at the pilot projects. We have a few people who've been with us since 2007, so they are really becoming specialists in this field, these elderly people. And at the moment we have two distance healthcare solutions in use. So the first one is called the Senior Line, and it's used by the customers at our geriatrics polyclinic. And then we have Smart Visio TV at service centers. It provides music, photos, quiz, and recordings from different events. Then also last year we had a pilot at home rehabilitation with a tablet solution. And I'm sorry to say we had some technological problems, so we are not having the same provider with this, and now we are looking for another solution because we already have the tablets we want to have back in use, but we had technological problems with them. So, is there anything to point with? Well, I can show. Okay. So this one is the senior line. This one is the tablet solution. So it's all used with the touch thing. And this one is the TV-based solution, so you use it with the remote control. Okay, thanks. And well, I say a few words about this senior line. And it was developed in an EU project called T-Seniority, and it was already built in 2010. And the most essential feature is the interactive video conference connection and an easy-to-use internet access through the touch screen panel. And through that, we can have interactive, personalized services. So it's a safe line. It's not a Skype or something like that. It's a safe line, so we can also have doctors and nurses talking with the client. And also we had some weekly programs, connection with relatives, and peer support. So the elderly people can connect each other with this. And I've been told we have a few minutes left, so this is one place where we want to use the technology more, so in home rehabilitation. So we want to have the technology following the people from the polyclinic to their homes, so they can use it and we can contact them through the solutions. I think I'll show you some photos. So these are from the pilot from the last year. So we had elderly people attending these programs and happenings, and also we took the video to show to those people who couldn't be there themselves. This is another example of a quite new technology solution we have. So we brought this mobile ERP and electric locks into our home care. And the goal is, of course, to enhance the work processes and get more client visit time. So in there we are using smartphones as tools for this ERP. Oh, sorry. And for opening the electric locks at the clients' homes. So we have smartphones with a Bluetooth connection, and when we go to the client's place, we can open the door with the smartphone. So you don't need to go to the office to pick up the keys, carry the keys, and then take them back at the end of the day. And also you can use the phone to do all the entries and logs of the visits while you are still staying with the client. No need to go back to the office again and pick up your papers and be on the computer and do it twice. So there are some advantages in this one. We got this running last year, and now we have it in the whole city. So that's a good thing. This is our last slide.
To sum up or to tell a bit of the new services that we have started, some of them last year, some of them this year, some of them maybe next year. Some new services brought to home, mainly for the home care clients that have started already last year, are detoxification, dental hygienist, and we also extended the geriatric services brought the home. Then we have also, that Mari told us before, the distance care solutions for rehabilitation with tablet solutions. I have to say that the home rehabilitation is something that I think conferences or workshops like this have, because it's something we've went and benchmarked from Sweden. The well-being technology rental shop is something we have that is not already existing, but something we want to develop for next year or for the end of this year. One goal, in addition to that, more services are brought to home in the future, is that to increase the personal's immediate working time with the clients in home care. And that we have started this mechanical dose distribution of drugs this year, and with 20 or 30 clients we are testing this automatic medicine dispensing service. It's this kind of machine that gets you these the drugs in a small plastic bag. So it decreases that because when the home care personnel used to dose the drugs in the dosette before, so now it's made before, and the home care personnel's time doesn't go to that, and there are no human errors that have maybe occurred before. They are not left anymore with this kind of solution. And also we are expanding the functional steering system and electronic door opening service to whole home care of Tampere this year and the next year. But thank you. There's a nice view from our beautiful city at the end.
Thank you very much, Ezzy and Mari.
Thank you.
We've just had a fantastic overview of actually a very integrated approach to senior services within Tampere. Have you any questions for Mari or Ezzy? Yeah.
Yes, I have like a few, but I will limit to one question. Okay. You said that you are like there is one neighborhood which is providing the services by themselves, right? So it means that they are contracting caregivers, and other neighborhoods are outsourcing the caregivers. I understood this correctly, right? So the question microphone.
Tarvittiinko se kotitorimallia? Niin mun mielestä. Oh, yeah, good.
Haluatko sä vastata se kotitori paremmin?
Yeah, I guess the kotitori model is quite complex to understand, but for the main area of the Tampere, we are purchasing the home care from our own city's own providers, but there's only this small area where about 300 clients living that we are purchasing the service from this kotitori integrator, who is purchasing it from smaller providers, but then when our own providers, for example, there are sick leaves and stuff like that, then there's this kotitori that they can get also the service. Because the kotitori has purchased it already, so they already have the set prices, and the help gets quickly then.
Okay, it's more complex.
Thanks very much for the nice talk. So I saw your numbers that 90% of old adults live at home. I mean, how can you expect even more live at home? I mean, this seems like a saturation number.
Well, yeah, it's 92% that
Right.
we are aiming right now. It's a bit lacking behind, but that's why we are developing the services taken to home all the time.
But I mean, is that really realistic? It sounds, based on some other numbers I know, this is astronomical.
Okay, yeah, that's something I think we have to discuss. But it's already been this 90%. So I don't think that's not that astronomical, but
About these locks, how are people reacting to people entering in their homes without, with the phones? What is the feedback of the people, of the residents?
Well, of course, you have to agree with the client. Maybe they can't move so well that they would want to get up and go to open the door. So, of course, you make the agreement with every client. But you are going to a client's home, it's their home, so you knock or you ring the doorbell before you or open the door with the phone.
I just have one question. With your shift to a lot of the sort of 24-hour service housing and the change in the culture and operations of the staff, how have you approached that so that the unions haven't been screaming and going on strike? There's a big culture change there in terms of employee patterns. How would you address that?
Well, it is hard, and we try to be really open about it. So every steering group we have dealing with these issues, all the documents are public, so the personnel has direct access to it, so they know what's going on. We've been doing some surveys with the personnel, asking them or telling them what's going to happen, and asking them if they have some place in mind or what kind of work they would like to do. If we are able to take that into consideration when we are relocating the people, but that's just trying to be honest and open. I think that's what we are doing.
Great, thank you. Are there any other questions? Essie and Mari, thank you very much.
Thank you.
Okay. So our next presentation is Tanya Hudink, and Tanya is the head of social security at the office at the municipality of Ljubljana in Slovenia, and Tanya is going to talk around home care services for independent living.
Good morning. It's a great pleasure to be here with you. At the beginning, I would like to present you a short movie about Ljubljana, actually about accessible Ljubljana.
Ljubljana is the capital of Slovenia and its cultural, educational, economical, political, and administrative center. As a green, clean, friendly, and safe city, Ljubljana strives to be a welcoming city for its citizens and visitors. In the last decade, we've successfully changed the heartbeat of the city. We've totally renovated the city center and created an eco-zone closed for motor vehicles. We've improved public transport and increased all other forms of accessibility in the city. In 2007, we closed the city center to all motorized traffic and arranged free and eco-friendly transport using the Cavalier electric vehicles. The eco-zone has been enlarged every year. It currently covers 98,000 square meters. Since 2012, the tactile ground system plan for visually impaired people in the city center has been produced and is gradually being implemented. A wide circular tactile path will connect Chopova Street, the Breg Riverbank, and Cankarevo Nabrežje in the city center. The city center features unrestricted access to the streets. Accessibility in the non-pedestrian areas is assured by the dropped curbs and ramps. Butcher's Bridge, which was constructed in 2010 with its jetty, lift, and accessible toilets that can be opened with a Euro key, features wheelchair access to the boats. Many other bridges over the river Ljubljanica were also constructed or renovated. The city of Ljubljana's renovation of the banks and bridges of the Ljubljanica project won the European Prize for Public Urban Space in 2012. The city's most visited tourist site is the famous Ljubljana Castle, which stands on a hill overlooking the old city center. The castle can be reached via the funicular railway that has operated since 2006 or by using the tourist train with a ramp for wheelchair access. The castle is part of the city's rich historical legacy and is therefore important for residents and visitors alike. In the castle courtyard, there's a tactile model of the castle with descriptions in Braille. Equal access and quality of life in the city is also achieved by providing accessible education and employment options for people with disabilities. Druga Violina, second violin, is a restaurant that provides employment for people with intellectual impairments. The city bus transport comprises over 200 modern buses. Many bus stops in the city center are equipped with signs in Braille and arrival information displays. A demand-responsive transport service for people with disabilities has been available since 2012. Most of the buses are low-floor buses. Many of them have audio and video stop announcements and removable ramps, assuring wheelchair and baby carriage access. Some public buildings, like the Stojica Sports Center and the City Hall, are accessible with the help of a system for the hearing impaired. Audio induction loops at some of Ljubljana Pharmacy's duty chemists enables easy access to the pharmacy services. Developing and implementing quality and accessible public services is one of the city's main focuses. Many of the programs and services are intended especially for the elderly. The city provides, free of charge, IT training for older residents, empowering them to start using new technologies and communications. Sports and recreational facilities, both indoor and outdoor, are also accessible for all residents. By constantly implementing user-friendly solutions and efficient services, we are assuring a friendly environment and high living standards. We believe in the importance of dialogue and therefore seek mutual solutions, including people with disabilities and the elderly, in policymaking. By recognizing the needs and wishes of our residents, we are constantly increasing and upgrading the quality of life in the city, and we are committed to continuing to do so in the future.
So I hope you enjoyed in pictures of Ljubljana. I will talk about family assistance at home. Here are just some statistic data. In Ljubljana is about 280 citizens. And about 50,000 citizens that they are older than 65 years. Sorry? It's okay. Thank you. The city of Ljubljana is member of the World Health Organization, Age-Friendly Cities Network, and European Healthy Cities Network Active Aging Subnetwork. We also had the mayor's counseling body, the Council for Senior Citizens, related issues whose main task is to draw attention to the needs of elderly. In 2013, the City Council of Ljubljana adopted an action plan, Age-Friendly Ljubljana, for the period from 2013 to 2015. Slovenian legislation requires certain obligations in the field of health and social care to be carried out at the local level. These include supplementary payments for institutional care, provision of family assistance at home, as well as subsidy of both services. Furthermore, the city of Ljubljana co-finances a number of various additional programs for the elderly in the areas of social care, health, education, culture, sport through public tenders. These daily centers you saw in movie are also co-financed by City Ljubljana. One of the most important tasks on the field of working with elderly is for sure providing family assistance at home, which is organized for more than 20 years. Throughout the first 10 years, implementing of the service providing family assistance at home was carried out by Ljubljana's Centers for Social Work and Homes for Elderly. Even then, the service represented a response to the demographical changes in Ljubljana and served as a replacement to early inclusion into the system of institutional care. Within the last few years, we have become even more receptive towards the elderly, and we have recognized the need of providing individualized service. The number of users of family assistance at home has increased over the years, and in the practice it has proved that it would be useful to even better organize the service. Our wish was to provide citizens of Ljubljana with the professional and quality service. With this aim, we have established an Institute for Home Care Ljubljana in 2002. However, since the need for the service increased over the years, we have decided in 2009 to give a concession for providing family assistance at home, with the aim to provide the service to even wider circle of citizens. Family assistance at home is social care service, and it's organized as a public service. The service of family assistance at home is provided and co-financed by local communities, in this case the city of Ljubljana. Part of the cost of implementing the service is covered by user. Part of the cost is co-financed by the city of Ljubljana in the amount of 80%. The centers for social work have the competency to accept user for paying the service if they are justified reasons for exemption. Family assistance at home is a professionally managed process that consists from two parts. First part is a professional part, while the second consists of direct implementation of the service. Services are implemented at the home of the user. The increasingly active and involved lifestyle of the elderly is reflected in their more obviously expressed intention to remain living independently and at home, actively involved in their local community. The main purpose of the service can be summarized into providing help to the users, ensuring them a higher quality of their lives and allowing them to stay at their own home longer or as long as possible. And also to prevent loneliness of those that are at home alone and to relieve the users' relatives at their own homes. Here are some statistic data. The services of social care are daily chore at users' home and are organized throughout the years between 6 a.m. and 22 p.m. Family assistance at home includes help with basic daily tasks like help dressing, undressing, help with personal hygiene, eating, performing basic living needs, help with maintenance and care of personal orthopedic devices, and so on. And then household help, bringing and prepare meal or buying food and preparing daily meal, washing the dishes, basic cleaning, taking out the garbage, and so on. And then the third, help in maintaining social contacts. That means setting up a social network with the environment, volunteers and relatives, monitoring the user in carrying out urgent obligations, and so on. Here are also price of family assistance at home. Sorry. Users, yes. The beneficiaries of the service are persons over 65 years old, due to their age are not capable of fully independent living. Then persons with disability status that are entitled to help under the law of social care for mental and physical disabled. Then other disabled persons who have the right to receive assistance and care to perform the basic life functions. And then chronically ill persons with long-term health problems that do not have the status of disabled persons but are, according to assessment of the Center of Social Work, are not able to live independently without occasional assistance of the other person. And at last, children with seriously ill children or children with severe physical or severe mental disabilities who are not involved in organized forms of care. Provision. Also, the Social Security Act requires municipalities to subsidize the family assistance at home in the amount of at least 50% of the price of the service. The city of Ljubljana have decided to subsidize the service with an even higher percentage, that is with 80% of the service cost, one of the higher in Slovenia. The difference to the full price of the service is covered only by those users that can afford to pay the difference. For everyone else, the difference to the full amount of the cost is covered by the city of Ljubljana as well. So with such high subsidy, Ljubljana is among those municipalities in Slovenia that contributes the most of the services of family help at home. A few words about our home care institute. It's a public institute founded by the city of Ljubljana. The main activity that is implemented by the Home Care Institute is providing a public work, family assistance at home. The basic tasks of the institute are provided in the context of public service, elderly, the disabled, and chronically ill with the help at home with basic daily tasks, household help, and maintain social contact, which is the core activity of the institute. Home Care Institute follows professional work, taking into account integration, individualization, and empowerment of the service users. In accordance with the possibilities, the institute is trying to respond quickly to the needs of the users of social care services at home, expansions of activities for the quality of the services, and for economical and efficient work. Long-term goals of the institute are directed towards improving the quality of services and to improve the conditions for the implementation of the activities of the institute. Services that complement work of our institute. Beside the development of home care services, there has also been an intention to provide and develop a wide range of different activities for Ljubljana seniors and for a better and more quality work of the institute itself. Besides the core activities, Home Care Institute has a goal to raise the quality of the services to prepare and develop a center for dementia, as there are more and more people dealing with dementia, to cooperate with the other institutes from the field of social care and health, both nationally and internationally, to cooperate at the different promotional events, festivals such as the popular annual festival for the third life period in Ljubljana, and so on. Home Care Institute also provides social service. Social service includes assistance with domestic and other chores in case of childbirth, illness, in the event of accidents and other cases where such assistance is necessary, to include people in everyday life. But social service does not fall within the public service network, and that's mean it's self-paid. A few words about Ljubljana City Library. Two services are particularly suitable for the elderly and disabled, and these are Bibliobus mobile library that brings books closer to those that live further away from the library locations, and then home library service intended for the members of the library that live in the city of Ljubljana but cannot visit the library themselves. All of the library services mentioned are free of charge. We wish that all the needs and initiatives of all generations would be satisfied in Ljubljana. Therefore, the city, together with its public institutions and enterprises, is trying for many years to ensure the conditions that would allow a healthy, active, and quality life for our senior citizens. We are convinced that the city friendly to elderly, disabled, and to children is a friendly place for everyone. We plan to further develop by building on our experiences in the field of elderly from previous year, as well as by listening to our citizens in order to provide services according to their needs and striving to also satisfy their demands. And I think that's all from Ljubljana.
Thank you very much, Anja. So, can you stay just for a moment? Are we any?
I'm sorry.
No. Are we any questions for Tanya? If I do, just when you were talking about the family assistance scheme,
Yes.
The family at home scheme, it was interesting that it's a universal service for older people and for people with disabilities and for children. Have you any, or can you give us any idea about the relative amount of activity across those sectors? So is 50% of the work with older people or 60%? What kind of?
I think it's the most work is with elderly. It's about 80%. This service of family assistance at home is for elderly.
Okay.
It's just 200 or something like that children and disabled people with family assistance at home.
Right.
And another 800 people is elderly or older than 65 years old.
Okay, thank you very much. Are there any other questions there? No? Okay. Tanya, thank you very much. So I think we're back on clock here again. So I think a coffee break, is that what we're looking at now? So I think we're downstairs, out this way for coffee. And if we can be back here in 15 minutes to quarter to 11. Thank you.